Good morning to everybody. My name is Carmelo Messina from Milan, Italy, and together with my colleague Dr. Domenico Albano, we are going to show you in this video the anatomy and the scanning technique of the radial nerve. The radial nerve arises from the posterior cord of the brachial plexus at the level of the axilla and receives the innervation from C5-T1 nerve roots. At the level of the arm, the radial nerve provides motor supply to the triceps brachii and provides sensory innervation to the upper arm by means of the posterior and inferior lateral cutaneous nerve. At the level of the forearm, of the wrist and the hand, the radial nerve provides both motor and sensory innervation by means of the deep and superficial branches. An important anatomic landmark for the radial nerve at the level of the upper arm is the spiral groove, also known as radial sulcus, which is located at the posterior aspect of the humerus, and we will see it in a few moments. At the axilla level, the radial nerve is located deep to the brachial artery. Then the nerve exits the brachial plexus and enters the posterior compartment of the arm, just distal to the teres major muscle, distal and deep to the teres major muscle. Then it courses from medial to lateral and it enters within the radial sulcus of the humerus, which represents actually one of the most common sites of potential entrapment in the traumatic or surgical setting. In the upper arm, it courses lateral to the long head of the tricep brachii and then descends between the medial head and the lateral head of the tricep brachii muscle. This slide shows more in detail the course of the radial nerve in the upper part of the arm. On the left, you can see another scheme that depicts the relationship between the tricep brachii muscles with the medial and lateral heads and the teres major muscle. On the right, the corresponding cross-sectional level, which is here depicted in blue, that clearly show how the radial nerve, here indicated with an arrow, courses between the medial head of the tricep brachii and the lateral head of the tricep brachii. Both of them are deep to the long head of the tricep brachii, which is more superficial. And now let's move to the live demonstration that will be performed by Dr. Domenico Albano.
To image the radial nerve, we should start our examination from the axilla, placing the probe in the short axis to search for our anatomic landmark, which is always the brachial artery. At this level, we can recognize the three nerves, which are the medial nerve, the ulnar nerve, and the radial nerve. The radial nerve is located deeper to the deeply to the brachial artery and tend to exit the brachial plexus, moving deeper, as you can see in this image, where the radial nerve travels to the posterior compartment of the upper arm. Indeed, to evaluate this nerve, I suggest to place the probe directly on the posterior compartment of the upper arm. So we ask our patient to change position and we place the probe on the posterior aspect of the upper arm in short axis, following the humeral shaft, because the radial nerve in the posterior compartment has a medial to lateral direction and crosses the spiral groove at the mid-proximal part of the upper arm. If we slide the probe distally, we can see here the radial nerve crossing the spiral groove. And you can also note that this nerve travels together with a small vessel, which is the deep brachial artery. This is an important site of entrapment of the radial nerve, which can be injured due to humeral fractures or subsequent surgical fixation with plates and screws. This is the most common entrapment neuropathy of this nerve. Then, to follow the radial nerve, we have to slide the probe distally. You can see the radial nerve between the two heads of the triceps, the lateral head and the medial head.
Now let's have a look at the anatomy of the radial nerve at the level of the distal upper arm and the elbow. At this level, very useful landmarks for identifying the radial nerve are the brachioradialis and the brachialis muscle. In fact, we can see that in this part, in the distal upper arm, the radial nerve is gradually shifted to the anterior and lateral aspect of the elbow joint and runs anterior to the lateral epicondyle of the humerus. Here it runs just between the brachialis and the brachioradialis muscle. This can be shown better in this cross-sectional image on the right, in which we clearly identify the radial nerve by its anterolateral position along the lateral epicondyle, just between the brachioradialis and the brachialis muscle. The brachioradialis is on the lateral side, while the brachialis is more on the medial side. We are now at the level of the elbow, and at this point we can see that the radial nerve exits from the posterior compartment and gradually moves forward to enter the anterior compartment of the forearm. As it enters the forearm, the radial nerve almost immediately bifurcates into the deep radial nerve, also known as posterior interosseous nerve, with the acronym of PIN, and the superficial radial nerve, and this bifurcation point is highlighted with a blue circle. At this level, we can also note that we can find the branching of the brachial artery into the radial and ulnar artery, and both are located on their respective sides. This slide better highlights the bifurcation point of the radial nerve into the deep radial nerve, which will be referred now as the posterior interosseous nerve, and the superficial radial nerve. As you can see from this cross-sectional image, the point of bifurcation is located just superficial to the radial head between the brachioradialis muscle, which is located on a more superficial aspect, and the supinator muscle, that is located on a deeper aspect. The posterior interosseous nerve moves distally, going on a deeper and posterior direction, while the superficial radial nerve will be the one that is located more superficially. At the level of the radial tunnel, the posterior interosseous nerve courses posteriorly between the two supinator muscle heads and provides motor function in the forearm. The supinator muscle consists of two planes of fibers. The first plane is that of the superficial head of the supinator muscle, which originates by a tendinous portion from the lateral epicondyles and courses distally to insert into the lateral edge of the radius tuberosity and the oblique line of the radius. On a deeper position, we then find the deep head of the supinator muscle, which originates by a muscular fibers from the supinator crest of the ulna and then insert into the dorsal and lateral surface of the body of the radius. The posterior interosseous nerve passes between the two muscles through a small tendinous opening, which is located in the proximal margin of the superficial head. This opening is heart-shaped and represents the so-called arcade of Froese, which is here depicted with an asterisk. The arcade of Froese represents a thickened tendinous proximal edge of the superficial head of the supinator muscle, whereas normally this proximal edge is thin and membranous. This tendinous thickening is developmental and occurs in 30 to 5% of people, most likely due to repetitive pronation and supination movements. As a matter of fact, this represents the most common site of posterior interosseous nerve compression along the radial tunnel. This cross-sectional image on the left better shows the course of the posterior interosseous nerve, which is here pointed with an arrow, at the level of the elbow, between the two heads of the supinator muscle, the superficial head and the deep head. At this point, the brachioradialis muscle is located superficially on a more ventral aspect. The second image that is now shown on the right side depicts the course of the posterior interosseous nerve after the radial tunnel on a more distal aspect. The posterior interosseous nerve at this point gradually penetrates deeper, coursing along the dorsal aspect of the forearm through the supinator muscle. It is then located between the supinator muscle and the muscle of the extensor compartment, which are located dorsally. It branches distally, providing motor function in the forearm to the muscle of the extensor compartment. The other nervous branch originating from the bifurcation of the radial nerve is the superficial radial nerve. As already said, this branching occurs just after the radial nerve exits from the posterior compartment of the elbow and enters into the anterior compartment. The superficial radial nerve provides sensory innervation of the dorsolateral aspect of the end. The proximal course is depicted in this cross-sectional image in light blue on the right side. Compared to the posterior interosseous nerve, the superficial radial nerve runs ventrally along the lateral border of the radius and below the brachioradialis muscle. These images show the point of the radial nerve branching. The course of the superficial radial nerve in the mid-forearm is depicted in this cross-sectional image in light green. As you can see, the nerve gradually approaches the radial artery at the middle forearm, while lying between the brachioradialis muscle on its lateral side and the humeral head of the pronator teres muscle on its medial side. When it moves more distally, the superficial radial nerve becomes separated from the radial artery, coursing lateral to it while approaching the radial side of the forearm. At the distal forearm, we follow the superficial radial nerve below the brachioradialis muscle until the nerve is shifted between the brachioradialis tendon and the extensor carpi radialis longus tendon. This point is here depicted in this cross-sectional image, and as you can see, we are still in the ventral and radial aspect of the forearm. Then the superficial radial nerve pierces the antebrachial fascia to reach the dorsal aspect of the forearm, as we will see in the next slide. At the level of the wrist, the superficial radial nerve courses subcutaneously proximal to the radial styloid. Distally, the nerve crosses posteriorly over the radial styloid and runs between the first and the second extender tendon compartment of the wrist. This is a very superficial location for the superficial radial nerve, and therefore it may be more susceptible to traumatic injuries. Now let's move to this last live demonstration by Dr. Domenico Albano.
Then the radial nerve shifts toward the anterolateral part of the anterior of the upper arms. At this level, the radial nerve can be recognized on the anterolateral aspect of the elbow, located between these two muscles, which are the brachialis muscle in the center of the image and on the medial aspect of the nerve, and the bicipitoradialis muscle on the lateral side. The radial nerve at this level bifurcates into small branches. As you can see in this image, the radial nerve bifurcates in the deep and superficial branch. The deep branch is also called the posterior interosseous nerve. The posterior interosseous nerve is as a motor function, provides motor supply to the posterior compartment of the forearm and shifts gradually toward the posterior compartment penetrating, as you can see in this image, the supinator muscle. To evaluate the posterior interosseous nerve, we ask the patient to pronate the forearm, and you can see the posterior interosseous nerve between the two heads of the supinator muscle, the superficial and deep head of the supinator. In this aponeurotic membrane, which is called arcadophrose, the radial nerve can be subjected to entrapment in neuropathy, especially in patients who perform chronic pronosupination of the forearm for working or sport activities. Then the posterior interosseous nerve travels in the posterior compartment, where it provides innervation to all the extensor muscles. If we go back to the bifurcation of the radial nerve, at this level, we can now follow the superficial branch, which is instead a sensory branch. To evaluate this nerve, we have to keep the forearm in neutral position, and the superficial radial nerve travels in this fascial plane deep to the brachioradialis muscle. You can also note this muscle belly, which is on the medial aspect of the nerve, which is the extensor carpi radialis longus tendon muscle. Moving to the distal part of the forearm, you can also note how this nerve becomes more and more superficial and penetrates the fascia, the fascia becoming more superficial and being located in the subcutaneous tissue. At this point, it could be useful to change your probe and to evaluate the nerve with the higher frequency probe. In this case, we can use an 18 frequencies linear probe. Following the superficial radial nerve, you can see how the nerve tends to shift towards the dorsal aspect of the distal forearm at the level of the radial styloid. At this point, the superficial branch of the radial nerve is located between the first and second compartment of the extensor tendons and provides sensory supply to the dorsal radial aspect of the wrist and the hand.
On behalf of me and Dr. Domenico Albano, thank you very much for listening, and we hope you find this presentation useful.